Hi guys, today we're going to talk about breast implant illness, something that we see all the time. Patients are presenting to our offices on a more frequent basis with concerns that they may have this condition. So breast implant illness is mainly a condition that is described by patients themselves. And as you can see, you can't even read what's going on, but there's hundreds of symptoms that patients have described, ranging from just general fatigue, malaise, irritability, backache, headache, diarrhea, overweight, restless, insomnia, leg pain, blah, blah, blah. I think you get the point. There's so many symptoms. It's one of the few conditions that exists in medicine with so many different symptoms that has been attributed to one condition. So is it real? As I said, it's a condition that has been described by individuals in certain social media groups, as well as some celebrities. And then there's always and what we are doing now as plastic surgeons is, with using science, we want to determine whether there is some truth in this, whether it is real. And there's been a number of journals that have been presented and published that have shown various different things, and we're going to go through them very briefly. So yes, we do take it seriously. I certainly do take it seriously. Why? Because in some studies are showing some patients are reporting an improvement of their symptoms. But there are also very good evidence, and there are women that are even now having their own social groups. They call it the breast implant regret social media groups, is one of the most common ones, where they truly have regretted removing the implants because the symptoms that they had haven't improved. So they may have something else. We're not really entirely sure. When a patient presents to my offices and they have a normal capsule, now the capsule is that scar tissue that forms around the implant. When you have this scenario and you're convinced that you've got breast implant illness and we remove the implant, in some cases we can get a very nice result. We remove the implant and we do a breast lift. Some of these patients do say that their symptoms have improved. Whether that's the case or not is debatable, but we obviously have to take it seriously, and we can get a very nice result. But sometimes you can have patients with these very thick, painful, calcified capsules around their implant, and they're often ruptured. And in patients like this with very severe presentations, they have a lot of pain, and it would make sense to me that we remove these implants entirely. Unfortunately, you sometimes cannot do a nice reconstruction in the beginning, and you may have to do this as a two-stage procedure. So what is some of the research showing as well is that the type of capsulectomy that one does, whether you remove the whole thing, part of it, or release, there's been shown to be no statistical difference in the reduction of symptoms in these patients. The other proposal by patients and social media groups is that there are increase in heavy metals in the blood as a direct result of the silicone implants. We know that this is not true because they've compared hundreds of thousands of women that have had implants to women that haven't, and they found that there's no statistical difference in an increase in heavy metals. And in fact, they looked at a group of women with tattoos, and they found that these control groups had higher levels of heavy metals in their blood compared to patients with silicone. And then we look at various biological markers, patients that have reported to have symptoms that mimic some autoimmune illnesses. And there has been a lack of consistent, identifiable biomedical markers that differentiate subjects that have got self-described breast implant illness from control groups. But what is important to talk about is this breast cancer and implants. It is always associated with textured implants. It is a very rare type of cancer. We call it breast implant associated anaplastic large cell lymphoma. The patients always present late, 10 to 15 years later, and they always present with this classic fluid buildup around the breast that you can see in this patient on the left-hand side. So my advice, if patients are concerned that they have breast implant illness, is to treat that patient as an individual. Always exclude other causes. It's important to have a full medical examination And in my case, I would refer all of these patients to either a physician or a rheumatologist to make sure that there's nothing else going on. The last thing you want to do is remove implants and the patient's symptoms haven't improved. I think you're doing them a disservice. I will always remove implants in patients that present with a ruptured implant, and by the way, the entire capsule as well, if there's any evidence of calcification, because calcification could be an early sign of cancer, and these are often picked up in the mammogram and the ultrasound. And if the patient has a textured implant and there's any fluid buildup, that implant must come out, and you need to send the fluid and the capsule for pathology to exclude sinister causes. And that's essentially breast implant illness in a nutshell. We are taking this condition very seriously, and there are ongoing studies. And the take-home message is just to treat each and every patient as an individual. Thank you.